We're here today to discuss a clinical trial, and this is specific to patients with a form of early stage non-small cell lung cancer. Non-small cell lung cancer is sort of an umbrella term. It includes a lot of different specific types of cancer, including adenocarcinoma, squamous cell carcinoma. Those make up the most common types, and then there are some other types which are less common. And these are usually treated as you've undergone with surgery to remove the bulk of the tumor. Or all of the tumor. But what we don't know is if there are little tiny pockets of cancer cells that are left over. And we know from experience that despite the fact that we have very excellent surgeons doing the proper surgery and under the microscope it looks like we got all the cancer, we do know that sometimes patients have their cancer return, unfortunately, and we're always looking for better ways to reduce the number of patients that have that happen to them. In the past, we've looked at forms of chemotherapy to try and reduce that, and unfortunately in the type of cancer that you have, which is stage 1 non-small cell lung cancer, the tumor that's between 1 and 4 centimeters. In the past, studies of chemotherapy have not actually reduced the risk of this coming back for those patients. But along has come immunotherapy in the last several years or last decade, and that has been proven to be very effective in a number of forms of non-small cell lung cancer. It's generally better tolerated than chemotherapy, less side effects for most patients. And so the thought is, by adding this on, could we avoid the toxicity of chemo, but also reduce the number of patients who have their cancer come back? And that's the hope for this trial. So this is a form of immunotherapy. The medicine's called pembrolizumab. And this is an IV medication. It's given once every 3 weeks. So you'd come in to see me once every 3 weeks. We'd make sure you're feeling okay on the medication. We check your labs to make sure we don't see anything that would be consistent with a side effect from the medicine. And then we'd send you over to infusion, where you'd get an approximately 30 to 60 minute IV infusion of the medication, and then you go home. And really, if you felt well, we wouldn't really need to do anything else over the next 3 weeks, and we just see you every 3 weeks for about 1 year. And during that time, we would be doing some CT scans to make sure that we haven't seen signs that your cancer is returning or spreading, and just to kind of keep a very close eye on you. And then after 1 year, we'd stop the medicine and you would go on surveillance alone, where we just keep a close eye on things and make sure you do well. So for right now, patients with stage 1 lung cancer, with tumors between 1 and 4 centimeters, just get surgery alone. They don't have any other options for treatment. And as we mentioned earlier, a lot of these patients, or at least more patients than we would like, have their cancer return, and that's something we really need to improve upon. By participating in this study, you're allowing us to evaluate whether this medicine helps or doesn't help. May not only help you, which is the hope, of course, but then if this particular medicine gets approved for patients like you will be helping patients going forward for many years.
The purpose of the study is to find out if giving a drug called pembrolizumab after lung cancer surgery does a better job at keeping the cancer from coming back than surgery alone. The usual approach for patients who are not in a study is to be followed closely by their doctor to watch for signs of the cancer returning. If you participate in this study, you will be assigned to one of 2 groups. This is called randomization. You will have an equal chance of being assigned to either group. This is done by chance because no one knows if one study group is better than the other. One group will be watched closely by their doctor to watch for signs of the cancer returning. The other group will receive a drug called pembrolizumab for up to 1 year. If you are assigned to the pembrolizumab group, you will receive pembrolizumab through a vein in your arm on the first day of each cycle. Each cycle will last 21 days. The cycles will repeat for 1 year until your cancer gets worse or you have severe side effects. You will have tests, exams, and procedures that are a part of your regular care and for study purposes. You will have scans every 4 months to make sure your cancer hasn't come back. Pembrolizumab is a drug that helps the body's immune system fight cancer. Pembrolizumab is approved by the U.S. Food and Drug Administration for use in advanced lung cancer. However, giving pembrolizumab after surgery for early-stage lung cancer is considered investigational. Investigational means that the FDA has not approved pembrolizumab for use in early-stage lung cancer. You may be eligible for this study if you are age 18 or older and have stage 1 non-small cell lung cancer that has been completely removed by surgery. Other criteria must be met to enroll in this study. Up to 368 people may take part in this study. To learn more, visit big10crc.org and choose Current Trials from the Clinical Research tab.